Welcome back in this abdominal wall portion of our breathwork series. So to begin, we need to start with the breath. And so I'll get you to come down into a comfortable seated or laying down position, wherever you can sort of feel some freedom in your ribcage. And just feel free to close down the eyes if that feels safe for you, or you can gently close them and tune into your breath. So as you breathe in, where do you fill? On the exhale, where does it empty easily? It may be helpful to bring a hand to the belly and one to the chest, or hands on the rib cage. And again, just an awareness. No judgment, no need to change. Just tune in to what you're aware of. So ideally on the inhale, what happens is our diaphragm drops down in order to make room for the air in the lungs. So our chest and belly should expand, but also our rib cage, so not just the belly. Okay? A lot of the time we think the bigger the belly moves, the more the belly moves, the deeper our breath. It's not necessarily the case, because the rib cage then doesn't move, and that's where the diaphragm attaches. So in order to get the most diaphragm movement, we need the rib cage to move optimally as well. Bringing a hand to the sides of your rib here and one to your belly. We'll see if we can just expand the breath into that rib cage hand. Breathe in through the nose gently. Belly and chest will come along for the ride, but focus on that rib cage, bra strap region, and let yourself exhale fully. Inhale again, rib cage expands. Exhale, everything deflates. Nice. I'll get you to bring one hand to your chest and that hand stays on your belly, and then tuning in there. Just keeping your focus on that, where your hand was before in that bra strap region there, but then breathing in and noticing what's happening with your hands and your belly and chest. Again, belly and chest should come along for the ride. On the inhale, they expand. On the exhale, everything should deflate together. You may notice that maybe chest goes first, or belly goes first, or opposite. And that's okay. Again, we're just bringing awareness and intention to our breath. As you breathe into that back rib space, are you noticing that balanced sort of inhalation through the whole rib cage and belly, or are you noticing an imbalance? And can you try to rebalance that out so everything's sort of breathing together? In this last imagery connection work, I'm going to get you to keep your hands where they are, or if you really feel like you need that input to your rib cage, you're welcome to put one or both hands there. But we're going to think about the path of the breath. So imagining almost like a candy cane shape. We're going to inhale the air in and down into the rib cage, then belly and chest expand. On the exhale, see if you can encourage the breath up and out from the bottom a little bit more, reversing that candy cane shape from the bottom up. We'll do 3 more here. Inhale, ribs expand. Chest and belly come along for the ride. We're drawing the air in and down, nice and long. Exhale, let it go, bottom up. Maybe that means that you engage your lower belly just a little bit to help encourage that path of the breath up and out. That's fine as long as you're not gripping and bracing too much. Good, last one here. Inhale that candy cane breath. Exhale, let it go, push it up. Nice. So play with that, work on that breath awareness of where does it move and maybe doesn't move so well. You find that balancedness between chest and belly. Can you expand the back sides of the rib cage as your thought of where you're starting your breath from, allowing the chest and belly to come along for the ride. And then are you able to play with the path, especially on that exhale, trying to encourage it up and out, just a little bit more from the bottom up, just so it becomes a little more active as opposed to a passive sort of seeping out of the breath. Give that a go, and also make sure you check in with our Breathwork Series 1.0 for ribcage expansion and mobility exercises that can help enhance and optimize that breath patterning in space, so that then that too will then help with the reflexive recruitment of the core, including pelvic floor, which is in part 1, but also the abdominal wall, and moving forward with this series. We'll see you next time.